I'm Tiffany Keene, and today I'll be doing the shoulder blade and shoulder girdle. First, we have the inferior portion of the shoulder, and it is right there. We have the superior border, the axillary border, and then we have the vertebral border, the spine, the scapula, and the acromion process. We also have the greater tubercle, the lesser tubercle, and the deltoid tuberosity. Then we have our muscles. The upper trapezium, the origin is the occipital protuberance, and it runs down to the lateral third of the clavicle. The insertion is on the acromion process, and this action is the scapular elevation. Next, we have the lower trapezius. It is the origin is the spinous process of the middle and lower thoracic vertebrae, and the insertion is the base of the scapula, or the spine of the scapula, and the action is the scapular depression. Next, we have the rhomboids. They are the square-like muscles in the shoulder blade. The insertion is, or the origin is the C7 to T5, and the insertion is the vertebral border of the scapula. And this action is in scapular retraction and elevation. Next, we have the serratus anterior. Those are mostly the boxer muscles you see in the boxers. They are from the lateral aspect of the first 8 ribs. They insert on the anterior surface of their vertebral border, and the action is the protraction and upward rotation. Next, we have the anterior deltoid. The anterior deltoid, it is on the anterior side, and it goes into the deltoid tuberosity. The action is the horizontal abduction. Then we have the medial deltoid. Its origin is the acromion process, and inserts on the deltoid tuberosity. The prime mover is the abduction. Then we have the posterior deltoid. It inserts on the deltoid tuberosity, and the origin is the spine of the scapula, and this is for the horizontal abduction. Next, we have the supraspinaceus. It is the above the spine. The origin is the supraspinaceous fossa, and it inserts on the acromion process, and this helps with the shoulder abduction. Then we have infraspinaceus. It is underneath the spine. The origin is the infraspinaneous fossa underneath the spine of the scapulus, and it inserts at the greater tubercle. This helps with the external rotation. Then we have the teres minor. The origin is the axillary border of the scapula, and its insertion is also on the greater tubercle of the humerus, and it helps in the external rotation. Next, we then have the subscapularis, and this is really hard to see because it's on the inside, the anterior surface of the scapula, and it helps with the medial rotation and it inserts on the lesser tubercle. And then last we have the latissimus dorsi, and it is the back triangular muscle there, and it also helps with the extension and hyperextension.